May I crave your indulgence? Let's give them some 5 minutes. If they don't come, we'll just listen to the one speaker and have discussions. I've just spoken to him. He's going to talk to us about HIV and schistosomiasis in Tanzania. I'm sure most of us don't have that kind of experience, so it will be good to listen to him. So please, I crave your indulgence. I'll be back here in 5 minutes, and with the moderator and the other two speakers having shown up, we will just listen to the presentation from Tanzania. Thank you very much. Okay, good afternoon again. We are going to start this session. Like I said, the moderator is not here, and we have only one speaker out of the three speakers. But I think it would be worth listening to our speaker. I am not your moderator, but I think I'm going to moderate this session. Unfortunately, I don't know the speaker, but I can introduce myself. My name is Emil Asamode. I used to work for WHO Regional Office for Africa. I retired some years back. I used to be the chief of staff of Dr. Moiti, the regional director. Before then, I was in charge of the regional program for HIV/AIDS for several years. But in today's, my capacity is the manager of this plenary hall. So what I do is to make sure that the session starts on time, the moderators are here, the speakers are here, and we move things forward. I will invite the speaker in the person of Anthony Charles. I will ask him to introduce himself, present his topic, and then make his presentation, and then we can have a discussion. If we are lucky and the other two speakers show up, then we can also listen to them. So, Anthony, you have the floor. Please introduce yourself, and then you can speak to us.
Um, Thank you so much. Good evening or good afternoon. My name is Anton Sebastian Charles. I am from Tanzania. Currently, I'm working as a health laboratory scientist in the HIV drug resistance unit under the project funded by PEPFAR and CDC. I'm going to present to you today the study which I did when I was in the university as a student at Kilimanjaro Christian Medical University College, Tanzania. I'm going to present to you the study called the prevalence and risk factors associated with genital schistosomiasis among living women with HIV in Lower Moshi, Kilimanjaro. Next, please. As we know, the genitoschistosomiasis infections has been associated with the increased risk of HIV infection in Africa, where the core infection are due to the social and behavior factors. We know it is about 40 million of people affecting with HIV, where 75 of them are women living with HIV, which of this 75% leading to the genital lesions. In Tanzania, where the endemic schistosomiasis it's about 50%, where 2.9% are in within those women living with HIV. Next, please. Um, we know we had a gap in identifying the risk factors associated with the female genital schistosomiasis in in HIV living women. That's why we did this study with the two main objectives, of which the first one is to identify or to determine the prevalence of genital schistosomiasis in women living with HIV, and the second one was to identify the risk factors associated with the genital schistosomiasis. Next, please. We conducted a cross-section hospital-based study in the area of Lower Moshi, which include two places of Pasua Health Center and TPC. All these places are found in Lower Moshi, where we include women living with HIV and the age between 15 and 49 who are not under anti-helminthic drugs, while we exclude those who are taking anti-helminthic drugs, where we found to have the total number of samples to be 260. Next, please. We use the simple randomly sampling technique for this study, where we include the outcome is the genital schistosomiasis status. It's either positive or negative, while the risk factors or exposure were HIV, age, marital status, resident, occupation, education, frequent contacts, and previous infections of schistosomiasis. Next, please. In our process, we do the ethical considerations. After there, we develop the questionnaire, we give them consent, then we interview the participants, we collected the sample, which was urine, then we sent for the laboratory investigations. After getting the data, we analyze them and we interpret it. Next, please. These were the demographic informations where the total, the highest percent it was for people who are unemployed, for the those who which the age between 31 and 40. Next, please. We identified the positive cases of female genital schistosomiasis was about the 5%. This is the very low prevalence. Next, please. Where we came for the risk factors associated, we include age, marital status, education level, education. Next, please. Residence, latrine ownership, reason for contact. Then we came to identify that the previous infections were the main factors associated with the female, the schistosomiasis in this female or in this woman living with HIV. Next, please. In our discussion, we conclude that the previous infection was statistical significance with the genital cystosomiasis, while the other factors were not associated with this outcome. Uh, this this study shows the low prevalence because we use the microscopic technique. It will be further significance if we could use the molecular techniques to identify the existence of cystosomiasis in the urine sample. So our recommendations, we suggest us to follow up the study with a larger sample size in order to identify the co-infection between genital cystosomiasis and HIV/AIDS. And we also advise the government or the partners to establish the mass drug administration, because we see that the previous infection were associated. So there is the need to establish the mass therapy to those people who are living with HIV and cystosomiasis. Also to provide awareness to the community members about the consequences of cystosomiasis in order to them to be aware of the how they can protect them with the cystosomiasis. Next, please. I acknowledge my supervisor, Dr. Maseke Mgabo, and Dr. Kajebuka, and Dr. Sixperson Kumbai, and also the team from the Kilimanjaro Christian University College, KCMC Hospital, Management and Development for Health that has funded this study, and the government of Tanzania in general. Thank you.
Let's give Charles another round of applause for showing up and for telling us about his study in Tanzania. Colleagues, you've heard about the work that Charles has done. He was looking at prevalence and risk factors associated with persons living with HIV/AIDS and schistosomiasis. And like he said, he did a cross-sectional hospital-based study in 2021, targeting women who were living with HIV/AIDS age 15 to 49 years. They found out that 55% of the women who were living with HIV/AIDS were infected with schisto, and the main risk factor was a previous infection with schisto. So that is the study that he has presented to us. I will now invite you guys to pose questions and make comments if you have similar experiences of this kind of study in your countries. Please, you can share that with us. So please indicate by hand when you get your mic. Please introduce yourself and then ask your question or make your comment. Yes, there's a lady in front here. Yeah, thank you.
Yeah, my name is Juliet Nyasuru from Stellenbosch University, South Africa. My question is a simple one. You mentioned of the low prevalence could be due to other factors, but what about your exclusion criteria? Because I saw that you had put in those on some treatment not to be included. Don't you think that that reduced the number of those who were positive? Thanks.
Thank you very much. Can we have one or two more comments, questions before I ask our speaker to respond to the question? Okay, Anthony, you may respond.
Thank you very much for your question. I think it's just a comment for me. With, without though, I can say we thought it could be the risk factor that causes the cystosomiasis, but what we faced, we path through the papers and literatures, we review them, and we identify that those who are using the anti-helminth drug above 6 months, the prevalence of getting schistosomiasis is very, very low. That's why we exclude them. Thank you.
Thank you. Any more questions? Any more comments? Well, Anthony, can you tell us a little bit about schistosomiasis in general in Tanzania? We have read from the literature of several studies that have been done in the past, and we want to see what kinds of interventions are being um, implemented at the national level to control schistosomiasis. But before then, there's a question. Yes, can you give the mic to that person? Please introduce yourself and ask your question.
Okay.
Can't hear you.
Okay.
Yeah.
Thank you very much for the beautiful presentation. Sorry, I was a bit worried when I saw genital. I was thinking maybe you are talking of the lower parts. Until when after your presentation, I was thinking should I be urogenital because it's misleading for me when you say genital. I was thinking it's a new discovery. Then, two, I want to look at what are the occupational factor. Majority of those women are they fisher, farmers, those that walk around the streams and so on. Because I feel those are some of the factors, fishermen, women and so on. So because I'm looking at, is there any, what prompted you actually to now link schistosomiasis with HIV? Is it any literature that talk about maybe immunosuppression is associated with increase in transmission or so that actually prompted that? Because I was so interested to want to listen to you when I first saw the topic. Thank you.
There was a hand here.
Yeah. Yeah, I think I introduced myself already, and I'm taking the advantage of the fact that people are not raising hands. So mine is just, I don't know whether it's a question or a comment. How would these findings, okay, I'm a public health specialist, very passionate about access to health services, strengthening health systems. So what message do you have for me? How would your findings, affect prioritization of maybe women with who are positive in terms of prevention, management, prevention, screening, management of those is it schistosomiasis? Thank you so much. Over.
Thank you very much for your question. I'll start by answering from that side. This study included the urogenital schistosomiasis. That's the first one. The second one, I think I will have to pose your question because I might have something very new if I will have retrieved the literature review because I can say it's too it was too fast because I did this when I was in university as a student. I had no knowledge about how to do it. Was a part of my practicing. Thank you. Coming to the second one, I can give you a message as a public health specialist because speaking from my experience in Tanzania, the women living with HIV are stigmatized. They are fear of finding the health services. Wherever they go to hospital because of high charges they can't afford. So I think this data impressed to establish the national policies of NTD program and HIV cases. We have to integrate the NTD programs and HIV care and treatment services because these people are excluded from getting health services due to the high level costs. Yes, thank you. Yeah, coming from the moderator, nowadays there are other institutions in Tanzania who are working with SCHISTOSOMIASIS program. Among of them is Muhimbili National Hospital and Muhimbili University of College and Allied Sciences. I think there are a lot of projects continuing there of SCHISTOSOMIASIS in endemic areas like in Lake Zone, also in coastal zone areas. So there are programs of NTD programs by different organizations funded by, by WHO and the neglected tropical disease organizations. I think according to the data, the endemic areas where schistosomiasis is about 50%. And this study was conducted in 260. So we have a lot of programs. So I can say when we get a report of this of all this of all this program, I think the prevalence would come into low because for example, in our university, I said that we established the national neglected tropical organizations, which specifically identify those people who are affected with the schistosomiasis only. So through maybe their work, they could come with data to show that the prevalence is decreased. Apart from that, the ministerial level, the Minister of Health and the minister called the Umi Mwalim, she does a lot of work in order to investigate where she can get fund, she can get support in order to work with schistosomiasis here in Tanzania. Thank you.
Thank you very much, Anthony Charles. Colleagues, I think we need to give him a big round of applause for keeping the fort, holding the fort for this session. So, Anthony, thank you very much. So we have come to the end of this session. I'm sure you have learned something new. In most of our AIDS conferences, we don't hear of the association between HIV and schistosomiasis. Schistosomiasis is a problem in the African region, and several countries have NTD programs. And one of the NTDs that they are looking at is schisto. But I think this is for me, this is the first time we're really hearing a presentation on how pregnant women living with HIV are infected with HIV. So this is an area that we can look into, and I particularly like the fact that there's integration, and I think the HIV/AIDS programs and the NTD programs should try and work together. So I'm closing this session, and I thank you for your participation. In my other capacity, I can now announce that the next session will start at 3:05. It's a satellite session organized by WHO, UNITAID, and PSI, and we'll be looking at self-testing. The topic is self-testing revolution, 8 years of STAR self-testing, lessons learned, and the road ahead. I think this is going to be a very interesting session. HIV self-testing has become increasingly more important, and we are going to hear the experience over the years. So those of you who are interested, that session will start at 3:05. Thank you very much.